if a product was selling at 4,000, or a packet of cigarette was going for 500 bob, if you increased it by 50%, you basically are saying you're selling at 750. Now that's significant, But what we have achieved so far is, 10 shillings, 20 shillings, 40 shillings. One will almost argue is marginal. But look at the costs, and Ministry of Health colleagues are here, of how much it is costing us to run the rehab centers. Part of the reason why we cannot sustain them, and I would like to hear from perspective from county officials. I see Mongai here, CC for Nakuru. I would like to hear that. What I know is that it's very expensive to rehabilitate somebody. And therefore, the argument then becomes that limiting entry, which is the public education point, of children, then becomes a more sustainable in the long run, as opposed to saying, and colleagues, what are we dealing with? Vice Chair here has reminded us, we are dealing with a sick person, with an addict. The cost is no longer a deterrent. They will steal money. I have had a cousin who would steal anywhere he went. He left cries. And the next minute you'll find him drunk or high on his own things. So cost ceases. In a context like ours, cost is no longer a hindrance. Is no longer a deterrent. You can raise it as much. But also because you also have counterfeit, products that are available, and that's the so for me, I'm still looking for a conclusive study. But from what I have read, it actually shows that we are spending far much more on rehabilitation than we are gaining from the sin taxes, and gain both in terms of reducing the number of people who are consuming, but we seem to have made a lot of progress by controlling the entry point, especially of the younger ones, the high schoolers, and what have you. Never mind that some of it seems like we are now regressing. If you look at just the number of liquor, I think every third shop now in some of our streets is a liquor shop, is a cigarette shop. That would be my intervention for now.
Okay, that's quite enlightening, but I think it's a discussion that I'm interested in having it as well, because actually, to say the truth, I am thinking of coming up with a legal framework around syntax so that we can even relook at how we are doing with the shisha, to see if it can be included in that group. Have very open discussions. So I'm really open to that.
Sorry, let me say one more thing.
Yes.
And if we see syntax, I know you said let's see syntax as a deterrent and not as a revenue. But we also are in a constrained fiscal environment. And that is why even the counties that are collecting it are not putting it for health purposes, as we've just been told. They collect it, they use it for other purposes. So it is no longer, because we are collecting it to fill in a revenue gap. That's a reality because of the fiscal environment. Again, which is something I think, again, has to be enforced if then this is going to go for the purposes for which it's supposed to be.
Very good. And I think those are now the issues that we really need to investigate. Now, I want to hear from Vice Chair around why is it that some counties are doing better than others? And after that, I'll come to WHO, because there is something very... Okay, I don't want to scare you, but there is something about the FCTC that I'm very keen on pursuing. The other day we were discussing about licensing or registering products, tobacco products. And I tried to find out, so what is it we base this registration on? What do we look at to determine if this product is fit for the market? Because I was recently assigned additional duties to oversee our National Quality Control Lab. And I was saying, this is a very good thing we can do. We can take these tobacco products, we have the expertise here, we can assess and see how much nicotine is inside, if there are any impurities there, and so on. So no, you cannot do that, because even the FCTC and the WHO have not given guidelines on how much nicotine is enough. They are worried that if they say that this is enough, then they'll be seen to be supporting. So be thinking about it, because I really think we need to do something about regulation, which is more than just putting graphic pictures and seeing if there are graphic pictures. I think we need to go inside the product to see what is inside, the one that is causing those cancers and so on, to see the one that is causing addiction, how much of the nicotine is inside. So as you think about it, Vice Chair, please, the distribution.
I think it all depends on the goodwill of the leadership of the county, because if they really want to do something, the money is there. They cannot complain about money. My county has the most bars, and my county is one of the richest counties. It has a lot of revenue, but not a single treatment facility. So again, it depends on the goodwill of the leadership, and also the CSOs, the FBOs, the religious organizations. You know, some of them are very active in public education and advocacy, especially now you see like down at the coast we have very many CSOs that are really campaigning against alcohol and drug abuse, actually even having drop-in centers whereby you just come for sessions, you come for methadone, you come for food, counseling, group therapy, one-on-one therapy, and then you go home. Although this one is a long-term program that can go for even 1 year or 2 years, other than the inpatient one where you have no access of the drugs. So again, like I said, it calls for collective responsibility. This campaign will start with the individual and then the family as well, and the community as well, even the church. We had a program where we were training religious leaders, because at least people congregate in a church, in a mosque, in a temple, at least once a week, whereby the pastor can be able to have maybe 30 minutes to talk about alcohol and drug abuse. Because at times, when we're not able to really deal with supply suppression, demand reduction also plays a very big part, whereby you give the information, share the facts, and save a life, so that these people are able to make tangible decisions. So when you share about the health effects, the whatever effects to these people, before they get to the addiction stage, because it all starts with use, and then it goes to abuse, and then it goes to addiction. Not everybody gets addicted, because genetic predisposition is a major contributing factor. That's why you see a family from their great-grandfather, and then they say it's a curse. It's not a curse. So unaona hiyo ulevi, majina Mureu, Wajohi, Kanyotu, Munye, all those names. Our great-grandfathers knew that certain families have that problem.
I completely agree with you. I think we have underestimated the impact of drugs and the substance of abuse on our communities and even on our economy. So I'm really keen on hearing from the audience if there is any clarification or question, because we have run out of time, but I'll allow WHO to respond guidelines. And then I'll give you an idea on how we can go about it.
Trying to focus on percentages, and this is what actually tobacco companies try to do, to try and feed the narrative that these results are exaggerated, that you can have this amount but it's still safe. But as my colleague there from NACADA mentioned, there's also genetic predisposition, so what you might think is a safe amount for one person might not be safe for another. It's the same for alcohol. There was that regulation that would say, if you have this number of units per week, you should be fine. It's okay. It's not. But actually, further research is actually showing that any amount of alcohol has potential to cause negative results in your body. So at the moment, the best outcome for us that we need to focus on is ensuring that we prevent utilization of tobacco products. I also wanted to touch on examples of counties that have been successful in implementing some measures to reduce, to tackle the issue of tobacco. The PS mentioned in the clip the issue of tobacco-free farms initiative. We have reached more than 11,000 farmers in Migori, Meru, Busia, and Bugoma. We have transitioned from growing tobacco to other commodities, including high iron beans. And this is not only beneficial in the amount of revenue they're able to collect from the farming, but also they're able to provide better nutrition options for their families and also contribute to local markets. So I think these are some of the counties that are doing initiatives that could be beneficial to other counties as well. And lastly, one thing that maybe also counties could incorporate in their county integrated development plans including tobacco control in those plans, to ensure that there are mechanisms that are there to support tobacco use control. Thank you.
One of the things that I wanted to probably explore is my biggest worry is that some of these people who are dealing in these, say, tobacco products, sometimes they will include some impurities inside, some substances, which now make it addictive for purposes of business, you know? So if we can be able to bring those, before we can register them to be sold in the country, we can bring them to the lab and identify if those impurities are inside. So we can use that as a basis of saying, no, this one we cannot register. At the same time, we can look at the ones that are already in the market, the ones that have already been registered. And we analyze and see how much nicotine is inside. So as a campaign of trying to reduce the amount, we say, moving forward, we want to encourage that we will only be able to register the ones which have less amounts of nicotine.
No, I get what you mean, and I think that some of the technology that is used for people who are trying to quit smoking, because you don't go from smoking a whole pack on one day to completely not smoking anymore. So they have some patches sometimes that they utilize that help to wean you off the nicotine. So in that sense, in the sense of trying to support the cessation services, maybe there are mechanisms that can be utilized that could support that. So we can have a bilateral.
Yeah, so let's not disclose too much detail, because I can see these people look very sharp. They can steal the idea and then we will remain with nothing. So I think we have really gone beyond our time. We actually, this afternoon, we have two activities. So this was the first one. I just want to really thank our panelists for really helping us through a very good discussion. So let's give them a big hand, a round of applause, so you can step back to your seats. Thank you very much. During the COVID-19 pandemic, these common ailments, the upper respiratory tract infections and so on, diarrheal diseases, they disappeared from our health facilities. And what it showed us practically is that if we just focus on these very simple interventions, personal hygiene, safe water, environmental sanitation, and so on, then probably we can drastically cut down on our public health problems and even the resources that we need to invest into the public health sector. So the next session, which will be on the Epuka Uchafu initiative, will be coming up shortly.
The moment you are addicted, the brain is not working. The brain is compromised. You don't think straight. And I said it's a disorder of the whole person. Because when you become, like, for example, you've said that a child can start taking drugs and become addicted, and the parents realize it, maybe after 4 years. Addiction, like I said, is progressive. And it depends on an individual body chemistry. Some people get addicted very easily, others take longer. For me, it took me more than 20 years. I started tasting alcohol when I was 10 years. I went to rehab when I was 41. So, unaona. And then in the rehab, a guy came who had drunk for 3 years. I told him, you need to be slapped, utandikwe vizuri sana, because unaibisha walevi. Urudi ukunywe na adabu, alafu ukuje. So, this is when I learned that it affects people differently. Different drugs affect people differently. My brother, like I said, addiction is genetic. The entire family was addicted apart from my mother. So in our family, we have 5 graves. My father died from alcoholism. My brother, alcoholism and drugs. My sister, alcoholism, and my niece. So we have 4 graves that are alcohol and drug related. My mom died of cancer. We were 7 in the family, now we are only 2. Me and my brother who follows me. My brother never went to rehab. Alitandikwa na wakora, akaokoka. So, rehab ni mara nyingi. So, about shops selling drugs, I said everybody needs to come on board. If you don't report that person who is selling drugs, how will the police know? If you don't report that person to the chief, how will the chief know? And that is why even I told my neighbors in Gishagi, Ushago uko kwetu, kama neighbor wako is selling marijuana. He's targeting your child. So if you do not report him, it's your child who is going to get addicted. So it's time we started, we came out boldly and talk about it and say, Chief, this and this person is selling these drugs. And then, Nakada, we have a helpline, 1192. You can call that number, say the location, the name of the chief, and then our officers now will take from there. Because at times maybe chief anaweza kusema ni fulani aliniambia, and then you get attacked by those people. Because at times they can be very malicious. So you can call our helpline number, 1192, and then say your location, the exact location, the name of your chief, the assistant chief, Ivo, ACC, and then they'll be able to follow up. Because at least now what we are doing, we are trying to open a Nakada office in every county. So far we've done 25. And I think we are doing good. And tutahakikisha zote zimepata ofisi so that we can be able to deal with the menace.
It's time we started calling things by their names. Politicians are telling us Mira, Muguka are good things for our children. We should arise and say no. Muguka, Mira are gateways to drug abuse. They are bad things, they are drugs themselves. So let's tell them also, our MPs, our MCAs, our president, everybody who is saying Mira is good, we tell them Mira is bad. Because that is one thing that he also talked about. And I've met many who are complaining about the same. The other thing is we have county, like now in the tobacco control. We used to have district enforcement teams where we were represented as CSOs. We want county teams to be also there this time. Enforcement teams at the county level. And those teams should also be facilitated even financially. We are saying the tobacco control fund should be devolved so that it trickles down to the county, so that counties can also feel that there is a tobacco control fund in the country that is reaching down there. And those cessation centers that are going to be put up by the Minister of Health, they should work very closely with the counties. They shouldn't decide for counties what the counties want. I've met county officials and they are having different views. So we want counties to feel that health is a devolved function. They are taking part fully in whatever is going on there. Thank you.
Now, in the interest of time, I want us to switch gears so that we can now get into the next area of discussion. And this next area of discussion is actually on an initiative called the Epuka Uchafu Afya Nyumbani, catalyzing investments for a cleaner, healthier, and wealthier Kenya. We are saying health is wealth. And so if we can be able to keep our populations healthy, then we expect that we are going to have a wealthy nation. Now, the same strategy to help us discuss this, I will call the following up on stage. We have Dr. Roslyn Mungai with us. Not doctor. Okay, I also have a bit of those powers to confer, but it is the other one, the other doctor of the village. Eh? So if you can take that one, it's okay. So Roslyn Mungai, can you join us here? And then we also have Morris Anyago. Is it Anyago or Anyango? Anyango, with an N, with an A. Very good, join us. We also have Chrysostom. Hey, Baraza. I know you as Chris Baraza. How did this other one come? And then we have Dr. Martin Mushangi. Please join us on stage. And last but not least, Wangari Karanja. I would like to recognize the presence of our First Lady from Migori County with us here, who is a champion of this initiative. We are proud to have you in our midst, Your Excellency, and we will be hearing from you shortly. So feel welcome. So our First Lady, Your Excellency, Dr. Agnes Ochilo, First Lady of Migori County. Now, to help us start this discussion, I would just like again to just play a very short video of 4 minutes from our peers around this issue, which is very close to her heart, this issue of Epuka Uchafu, just to understand the concept. She is a champion of it, and it is an initiative that borrows from some of the experiences that we have seen in the past, and especially during the COVID-19 period, when we actually were able to demonstrate the very big impact that some of the simple public health interventions can be able to have.
Across Kenya, from the rolling hills of West Pokot to the shores of Lake Victoria in Homa Bay, our communities thrive with resilience, hope, and unity. Yet hidden with this vibrant life are silent threats that undermine our well-being, starting with uncollected waste, stagnant water, unsafe sanitation, and the spread of preventable diseases. To confront these challenges, the State Department for Public Health and Professional Standards has initiated a transformative national campaign aimed at building cleaner households, healthier communities, and a safer environment for every Kenyan. This homegrown movement is anchored on 4 powerful pillars. 1, personal hygiene. 2, environmental hygiene. 3, health protection at our ports of entry. And 4, access to clean water and sanitation. Together, these pillars provide the foundation for disease prevention, improved livelihoods, and national prosperity. This campaign envisions that every 3rd Saturday of the month, Kenyans across all 47 counties will come out together for Public Health Action Day. And these days will be dedicated to cleaning our towns and villages, promoting menstrual hygiene, ensuring food safety, advocating for clean cooking, and expanding access to safe drinking water. The spirit of volunteerism, civic responsibility, and public participation should reignite our collective resolve to protect our health and our environment. Since August 2024, 7 trailblazing counties, West Pokot, Machakos, Kisii, Narok, Kisumu, Migori, Tharaka Nithi, have already activated this initiative, showing that progress is not only possible, but within our reach. Guided by county governments, community health promoters, and public health officers, the Epuka Uchafu Afya Nyumbani initiative is harnessing the power of local leadership and existing community structures. It is a Kenyan solution rooted in the values of shared responsibility and national pride, and it is already demonstrating visible impact on the ground. In the coming months, the initiative will be scaled up to more counties, including Murang'a, Mombasa, Nairobi, Kwale, Turkana, Samburu, Laikipia, and Embu counties. Every household, every community, and every point of entry will be engaged, because a cleaner Kenya starts with each one of us. It is in this spirit that I warmly welcome you to join us for a special side event at the Devolution Conference themed Epuka Uchafu Afya Nyumbani, catalyzing county investment in preventive health for a prosperous Kenya. This high-impact engagement will take place on the 14th of August from 2 p.m. to 4 p.m., bringing together county leaders, public health experts, development partners, and community champions to share best practices, mobilize resources, and forge stronger partnerships for preventive health. Epuka Uchafu is more than just a campaign. It is a movement for dignity, for health, and for the future of our nation. We call on all leaders, our citizens, and partners to join hands as we clean up Kenya, one household at a time. Together we can. Together we will. My name is Mary Mudonyi. I am the Principal Secretary for Public Health and Professional Standards.
So now I will take the next few minutes just to introduce our panelists so that we can be able to know who is on the panel. And we will start with Roslyn Mungai, who is the County Executive Committee Member for Health, Nakuru County. Nakuru County is among the best counties in the area of water and sanitation, reporting 89.1% of households with improved sanitation facilities and 71.6% of the households in the county accessing safe drinking water. The county has also made significant strides in implementing a multi-sectoral approach in improving sanitation services across the county by launching the County Fecal Sludge Management, that is the FSM, regulations early this year. However, waste management in the county remains a challenge. Let's put our hands together for our panelist from Nakuru, Roslyn Mungai. The next panelist, Shangi, who is the Director, Population Health and Environment at AMREF. I will stop at that because I want you to give a little bit more about yourself even as you will be presenting. Let's put our hands together to Dr. Mushangi. Chris Baraza is the General Secretary and Chief Executive Officer at the Christian Health Association of Kenya. Now, Dr. Chris recently took the mantle at the Christian Health Association of Kenya, that is CHAK, for those of us who know CHAK. In other places, when you say CHAK, it means something else. You know, it means something that you can drink. A leading national faith-based organization of Protestant churches, health facilities, and programs from all over Kenya, established in 1946. CHAK has a network of 587 member health units across all the healthcare levels, from primary healthcare facilities to hospitals located in 45 counties of Kenya. The next panelist is a representative of the Secretary General of the Kenya Red Cross, and probably we will allow him to speak a little bit to himself when he comes in to answer, because I have the profile of your boss. So I will not be able to say it because that one is different. And then finally, we have Wangoi Karanja, who is the Chief of Kisumu Field Office at UNICEF Kenya. UNICEF works in over 100 countries. Is that real? 100? Izo zote? 192? Okay. So UNICEF works in 192 countries to help provide access to clean water and reliable sanitation, and to promote basic hygiene practices that keep children safe from infectious disease. Some of the work that UNICEF is doing is in the area that resonates with the Epuka Uchafu campaign, which is number 1, supporting behavior change and sanitation and hygiene at the community level. Number 2, creating a social norm of ending open defecation. And number 3, encouraging people to build and use safe toilets. So let's give our panelists a big round of applause. Epuka Uchafu is about what we want to achieve in UHC. Because UHC is generally based, it is something that cannot be achieved if we do not have very strong primary healthcare foundations. And at this point, we have to note that for us to be able to have strong primary healthcare foundations, then at the center of what we are doing, we must put focus on disease prevention and health promotion. So the simplest interventions like hand washing, like keeping our environment clean, sweeping our surroundings, and making sure that, bushes are cleared and things like that, actually go a long way in making sure that diseases are prevented. And so, the Epuka Uchafu campaign speaks squarely to the issue of primary health care and by extension, universal health coverage. So I want to start with you, Roslyn Mungai. And of course, you are a policy leader, in your current portfolio, a policy leader in matters health in the county government. So what are your perspectives on joining the Epuka Uchafu momentum to improve waste management in the county, to contribute to disease prevention and a safer environment for the residents of Nakuru County?
Thank you very much, Daktari. First of all, I was speaking with the doc here earlier when we showed up at the hall, and I made an observation that he challenged me to ask you about. I note that there are a number of toilet facilities in this conference, personally. As a person who has attended almost, I think, all the devolution conferences since 2013, my observation is that we've done extremely well. So I wanted to thank the Council of Governors for that. Secondly, to say that Nakuru County, we 100% behind the PS in this campaign. We actually think, because the Epuka Uchafu initiative, I think it was scuttled a little bit last year. And so a lot of the counties that are supposed to have already activated have not activated. And I think she said that. What I would push for on behalf of Nakuru County is a 47 county one-day activation, because we must go back to the basics. We cannot wait until the activation happens for us to engage in these good practices. So that's the first thing, or rather the second thing. The third thing I'd like to say in supporting the Principal Secretary and also the Ministry of Health is to say that this cannot only be a Ministry of Health or Department of Health initiative. One of the key buzzwords that the PS likes to use is multi-sectoral. There's another word she uses which I've forgotten. We must engage all departments within the county government, maybe within the national government as well. So in Nakuru, for example, one of the things that we have done in fighting disease, the spread of disease, and in promoting and preventing diseases is to set up an interdepartmental mechanism. One is the Nakuru, it's called NACOSTEC, it's a very long acronym, but what it essentially means is that myself as a County Executive Committee member for health and my counterpart in environment, environment, water and climate change co-chair an executive team that handles all these that is the word she uses, multifaceted drivers for the spread of disease. And the second one is a citywide initiative that focuses on, for example, Nakuru is a city and all our 4 municipalities. So working with others, I think we are going to achieve a little bit more, and that includes also the civil society. The other thing that I'd like to say is the departments of health across the country must lead by example. So let me share a few things that we have done. We have an initiative in Nakuru called Ngarisha Zahanati. You do not want to go to a health facility, Daktari, and find that is where the germs are. Obviously, that is where they are, that's where the diseases are. But we want to be sure that across all our 219 facilities, hygiene is maintained. So our facilities have established a day when they engage with the community health promoters, all the healthcare workers to clean exactly the way she presented here, but for health facilities. But the other thing is, in terms of ensuring that the facilities are leading by example, is to embed a mechanism of supportive supervision that also looks at our toilets, that looks at our kitchens, that looks at our theaters to make sure that they are fumigated and all that. So Ngarisha Zahanati is an initiative that we began last year and it has caught on fire. You all have heard about the mpox, the spread of the mpox along the northern corridor. I want to thank all the partners who are sat here. I can see the Kenya Red Cross, the UNICEF, the AMREF, and many organizations that have joined hands with us. We cannot do this alone. We must engage communities. If you think about the mechanism of the spread of the mpox disease, it is basically a sexually transmitted. It's basically sexually transmitted. So working with the communities along the northern corridors to make sure that the lodges are clean, to make sure the eateries are clean, it's a prime agenda for us. The other thing is we developed last year, and this is a policy intervention. That was what you asked me. We developed a set of standard operating procedures for the cleaning of public toilets. Because that's a place you do not want to go and find uchafu. So we developed those SOPs. They were approved. We went around the county training the cleaners and the owners of public facilities, eating facilities, all these public toilets, including the ones in the markets, giving them the combination of those reagents for the cleaning of the facilities and ensuring that they're using the right protective gear. You spoke a little bit, Dr. about management of the waste. You know, Her Excellency, the governor has zero tolerance for public, like mounds of waste all over the place. If she finds it, you're in some serious trouble. But you know, our waste is it's deposited in landfills. Like the biggest one is as you go towards Kabarak. It used to be called Gyoto, and those of you who know that area know it used to be an eyesore. It's now gone. The waste management is much, much better, but I have been told by the experts that when you bury a landfill, you create a mechanism for the emission of dangerous gases. So that's something we are really, really looking into presently. Finally, because I know you want me to stop, is climate change, because she spoke a lot about environmental hygiene and sanitation. One of the initiatives that we have had in across our 219 facilities is to create what we are calling the Governor's Healing Gardens. We want our health facilities to be centers of excellence in public maintenance of public spaces. So the planting of fruit trees and the contribution that it makes to the environment within the facilities, but across the county, these fruit trees are now being used to feed our mothers in the maternity, ensuring that it is 100%, sanitary. Then the other thing is to create those, in terms of healing gardens, floral appeal. So that when you come to the facility, we're not adding an extra layer of stress to you. I think I'll stop there and allow others, and I can come back later. Thank you.
One of the things that I can tell you is that I think we are already seeing the natural kind of process, where this is a brilliant idea, but because it is relatively new, we have lived with it, but we have never really figured it out. We have never really been able to look and see the power that lies in this initiative. So we have the early adopters, and Nakuru is one of them, but then we have the laggards who are waiting to be able to see, okay, so what is this thing? They really want to see, okay, when these ones go, are they going to succeed? But you see, when you speak about some of the things that you're already experiencing, it is very, very enlightening. It is very heartening for some of us to be able to see that actually there are some people who are already doing it, they're taking it seriously, they're not looking at it like a simplistic thing, and leading the way, so that now the others can be able to see and follow suit. So at a policy level, I think that is really commendable. Now, for those of us who are at policy level, of course, we have noticed, and you even alluded to what the PS said. This is something that we have to do in terms of partnerships, We have to partner government, national, county. We have to work very closely together. We have to work with our partners. And that's why, the first time I met Martin Mushangi, I think it was in Liverpool. Yeah? And he was just talking about WASH. So I was wondering, this person, there's nothing else he thinks about apart from WASH. He was just talking about WASH, the region and so on. And I told him, okay, That the time I was heading the neglected tropical diseases program, so I told him, yeah, there's a place for that, and probably we can work together. But then I came to know you better, and I saw you as a champion of WASH. And when I started understanding it better, I realized how powerful it is. So as an individual, and even for the organization you work for, AMREF, what are some of the reflections that you can be able to share with us, in terms of your own objectives and your organizational objectives towards achieving the WASH goals, and how does it plug into this Epuka Uchafu initiative?
Thank you so much, Doc. And I'll just begin from where you left it. And you said we need to return to the basics. I'll not concentrate so much with the science because sometimes we lose people because of complicating issues with numbers and the depth of science. But this is what it is. I think if you look at the diseases that we are facing, whether it is diarrhea diseases, upper respiratory infections and all that, they stem from poor water sanitation and hygiene. And that's where I'll premise my argument. But before I get into the depths, I work for AMREF Health Africa. It's an NGO. Our vision is creating lasting health change across Africa. And we do that through primary health care. And so picking it up from there, you understand that the core principles of primary health care is keeping people away from diseases. And how do you keep people away from diseases if they don't have access to clean water and sanitation services? How do you keep people away from diseases if all the factors that we know normally spread the diseases are not controlled? And so when we got into the conversations around Epuka Uchafu, personally I was tickled. From a very personal experience, when I joined AMREF to go and work in Busia. And when I went in Busia, there was one KPI that we discussed with the CEC of that county, and the governor. And we said that we are going to make Busia open defecation free. For those who do not understand what open defecation free is everyone in the community has a toilet, is using that toilet and are actually washing their hands. But the impact was not all about getting open defecation free status. We managed to demonstrate that diarrhea diseases came down significantly. And so now when coming to the issues around Epuka Uchafu, I know Kenya as a country, we have lost the opportunity to actually shine. But there is hope. There is hope because we are already talking about it here. And I see political commitment, both from the county and at the national level, to actually do some few things. Number one, to raise awareness. Somebody always says that if a man starts laughing at themselves, then that person is on their way to healing. And I think as a country, we are on our way to healing. We are somehow at a point where we know we cannot progress properly with primary health care without proper water sanitation and hygiene. So awareness, that is one thing which we need to do and do it very well. As we come out of this meeting, let everyone take it as a point to go spreading the word that if you keep clean, you are going to keep healthy and you become richer. That's point number one. Point number two, we need to invest. And we need to invest seriously in this. And when I'm talking about investment, people always think about money. But we need to invest ourselves from the social capital perspective. Let the preachers actually go out there in the pulpits and say, people need to keep clean, okay? Let the teachers in schools invest in their children, impacting morals in a way that those children actually understand the imperatives and the importance of keeping clean. And at the end of the day, we also need money. So, and that's why we are here. As an organization and from AMREF, we have been together in this journey, and thank you so much, UNICEF, Kenya Red Cross, CHAC, and the counties and the national government itself for the money which we have advanced. It's not enough. So we need to start thinking about how do we generate good enough money, how do we bring together actions which are fragmented in a way to consolidate the change and make sure that this country is actually realizing the vision of a clean and a wealthier Kenya. Thank you.
Chris, you recently moved to CHAC. When I look at CHAC, I just see hospitals, you know, a network of hospitals. And WASH, the way I know it, is a community thing, you know, going into the community, talking to people to wash their hands, you know, save water, boil the water, and things like that. So this network of yours, this CHAC, how do you see it plugging into this conversation? Does it have a place in the Epuka Uchafu initiative? And how would it plug in bringing these public health interventions, the nexus between that, the hospital network, and the communities moving into the future? Do you see it playing a significant role, and how?
That's how I used to think about CHAC before I joined. But now I understand it differently. That we are not just a network of over 500 facilities, but there's a lot more that actually CHAC does in terms of healthcare programming and in terms of just ensuring that the member health units are well taken care of. When PS Modoni reached out to me at some point and requested if we can work together, I mentioned to her that it's an opportune moment because it aligns with our guiding principles of also achieving UHC as CHAC. And when I reached out to Daktari here, Grace, she told me there's a space for you as the FBO fraternity to be able to work with us. And why that's important is because as a faith-based organization, there are actually three things that we value, and we work and walk in the steps of Jesus Christ, Daktari. And Jesus Christ, in the 3 years that he was in the public ministry, did three things. And one was to teach, the second one was to preach, the third one was to heal. So as CHAC, we do all those three things. When I look at the tenets of Epuka Uchafu, actually it has all those, apart from one that's not coming out very well. And that's how CHAC comes in, the one of preaching. And we purpose to work with this initiative because at least 90% of Kenyans are confessed Christians. Whether they practice is neither here nor there, but they are confessed, okay? They are confessed to a particular religion. So you can imagine, Daktari, the multiplier effect that we'll have if at any point in time, assuming 50% of the Christians go to church on either Saturday or Sunday, and if 50% of the 90%, that's just about 15 million Kenyans, if we just gave to the pulpit 5 minutes to talk about Epuka Uchafu every Sunday, the impact will be significant. And Martin, I know you've talked about that already. So how do we have the health education merge with the preaching for us to achieve health interventions that are working towards achieving UHC? And I think that's how we come in. The second thing I want to talk about is that as the faith-based fraternity, we are actually organized into what we call the Kenya Faith-Based Health Sector Consortium. And this has the Catholic Church, the Pentecostal Church, and SUPKEM. And the three combined actually contribute to about 40% of healthcare service delivery in this country. So it's a significant population that if we actually harness and work together, we should be able to actually approximate achievement of UHC. Thanks, Dr.
You are now bringing to the four things that we had not thought about. Imagine how that platform of the churches can be able to plug into this initiative. I think that is something that I will definitely be carrying with myself. Now, Mr. Anyago, there's something called Public Health Action Days. The PS talked about it. You know, like I think we've seen it happening in jurisdictions like Rwanda. You know, once in a while you see even the president coming out and they go and clean the streets. I don't know if you have seen that. And I'm just thinking, Kenya Red Cross, you know, how do you see it plugging into this kind of initiative for public health action days? And what is the place of multi-sectoral collaboration? Because I know Kenya Red Cross does a lot of that, yeah? Having been a board member of Red Cross and having been a member of that family, we, Red Cross is very big on multi-sectoral collaboration, community initiatives, in the perspective of public health action days. How do you see it working through the lens of Kenya Red Cross, and how does Kenya Red Cross come in to be able to provide momentum towards that kind of initiative? And remember, we had not introduced you well, so you take the first 30 seconds. I will add you 30 seconds at the end, just to introduce yourself.
Thank you very much for this opportunity. My name is Maurice Anyango, the head of region for the Kenya Red Cross, West Kenya region, and in which West Kenya region covers 6 counties in Nyanza and 3 in Western. But I'm here representing the Secretary General for the Kenya Red Cross, so I'll give a national holistic approach about the issue that we're discussing today. Epuka Uchafu initiative, if we look at it critically, it is something that is embedded within the Kenya Red Cross programming. And if you look at the 3 pillars that we have within the Kenya Red Cross, that is communities under disaster management, communities are able to anticipate, prepare, and respond. Such issues to do with hygiene and sanitation, preparedness to primary health-related issue come in very, very handy. And if you talk about health, where there's a second key area that we work in, where we want communities to have healthy lives. And of course, with the communities having healthy lives, we realize that we'll have a vibrant community that contributes to the economic perspective of every community in this particular county. And the third pillar is on youth, where we say the youth are able to come up with innovation and of course lead positive change within the communities. And straight to the question that you've just asked, this initiative of sanitation and environmental action days is key. We as Kenya Red Cross, we have started it, and we are working in all the 47 counties. And we are saying at least every month we are doing an environmental and hygiene sanitation promotion days. And this one we are working very closely with the county governments within those particular counties, the relevant stakeholders, and of course bringing the entire communities also in those particular areas to identify and see the essence of living in a community that is clean, and of course a community that is of course also accessible to other services like clean water. And this we have seen within our parameters of working with the county government, with other stakeholders. It has started bearing fruits. And of course, we will continue to remind and of course push the agenda of policy review, and of course even putting into other legislations, so that every county in this country can come up with a specific date that communities can come up and of course look at the environment and look at the initiatives that they can put in place to ensure that we live in a very healthy environment that is of great help, not only for us, but also to the generations to come. And what I want to say in that, we are also trying to strengthen the existing programming that we have within the school clubs. And we have seen that as we continue to mobilize our teams, working with the partners, we have seen a very, very huge reduction on some of the simple things that are very important that can contribute to the healthcare of this nation. And thank you. Back to you.
Now, at the risk of looking like a rogue moderator, I'm asking very hard questions. So I want to move a bit far from Wangoi, so that when I ask you, you don't by reflex, maybe injure me. Now, and they are very hard questions. So UNICEF, we have 192 countries. That is huge. Yeah, that is quite a huge network. But we have known UNICEF for working for children. Personally, me, that's what when I hear UNICEF, I just know it's children, you know. At one point, I was even struggling to now place the full name so that I can see United Nations Children, but then it doesn't really enter nicely. I see a misplaced I somewhere and E, I don't know what they stand for. But generally, it's about children. So what comes to mind is these children are very, they are very powerful agents of change in the community, Actually, like even, most of us, our kids, when they come home from school and they have been taught something, they will make sure that it is implemented. They follow through and make sure that it is implemented. And I see, this whole thing about behavior change, changing our behavior. Epuka Uchafu is about changing behavior, taking on, better hygiene, personal hygiene, and so on. What are your thoughts around the potential of taking advantage? I don't know if that is a good terminology, but, just being able to utilize or to leverage these very powerful agents of change to be able to drive the Epuka Uchafu message or the campaign, either in school or in communities within the context of UNICEF. Is it something that you see to be possible? What is the fungibility of it? What are your thoughts?
Thank you. Thank you for the question. First of all, UNICEF stands for United Nations Children's Fund. Back in the day, it was United Nations Emergency Children's Fund, but we stopped working in an emergency mode. We now do development work, and so now it's United Nations Children's Fund. So we never dropped the E, so it remains there. It is part of us.
And what is the I? It is misplaced somewhere.
That is the name.
Okay.
Yes, United Nations Children's Fund. So yes, children, like you said, are ambassadors for any good message. And I'm happy about the point you have raised, that even in our households, when children got a positive message, something that excites them, they come home and they are very ready to implement. And so there's already a direct relationship between children as agents of change and the communities that they come from. But I think as UNICEF, we have really capitalized on the school platform, because the school is where many children convene every single day in this country, and in all those countries and territories that you've mentioned, over 100. And with the right message, with the right skills, with the right environment, with role modeling, they are very powerful agents of change. And in the country, we have experience of some of the programs or initiatives using children, using schools. And let me just backtrack a bit. Yes, that is our primary constituent. And so we think that it is for children with children. And so we are very intentional about making sure that they are part of our programming. You're not just programming for them, but you're actually programming with them. And they are part of implementing some of the strategies of the organization. And so we have programs like the Football for Wash. I think you may remember it some time ago. Then we have the STEP program, which is School Toilets Enhancement Program. And then we have the Make a Splash. We have the UHC for the Sanitation for UHC program. All of these have worked with children. And at the very basic minimum is to make sure that in schools there are clean toilets. And we try to advocate for even that toilet pupil ratio for girls, for boys. That is important. And hopefully for the girls, even with a menstrual hygiene management component. We make sure that there is a hand washing station, that has soap. If there's no soap, ash can also do. And then lastly, making sure that there's safe water. So just that 3-star approach is a basic essential when it comes to what we want to see in schools with this big population benefiting every single day. I think the second thing is we are keen on health school clubs. Yeah, health school clubs where you have a patron or you have a teacher who you train and who works with a small group of students, and those children become agents of change within their school. And there's that peer-to-peer learning. And children like to copy each other. You know that. If a child is washing hands and is told how fantastic it is, you'll find in a short space of time, all of them are washing hands. So this become, the patron or these school health clubs become, can I say, a catalyst for teaching children the right thing to do. They also become leaders in global days when we are celebrating, for example, Global Hand Washing Day, Menstrual Hygiene Management Day, World Toilet Day. They champion the programs, the activities, school cleanup, and in a sense, then you also begin to develop their leadership potential. We also like talking walls. Talking walls are murals and paintings and messages that we put in schools. That is a constant reminder and a trigger that children will pick, they'll talk about, they'll be excited about, and usually they're developed by children themselves. So it is in your kitchen, it's in your classroom, in your assembly hall, in your toilets, and so those talking walls are really important. The other thing that we have done is in the community-led total sanitation space, children, we encourage children to be part of the village committees. So if you're already in the school health club, you can very well actually be part of the CLTS triggering space in your village, in your community, yeah? So those are some of the examples that have really worked well in engaging children. Then in menstrual health hygiene management, we want girls not to feel stigmatized and to feel that when they go to school, it's a safe space. So just orienting and sensitizing boys about menses of the girls. Why does your latrine block look different than ours? Why does it have a shower? Why does it have that extra something that ours doesn't have? And explaining that. And boys can be very supportive of their girl peers when they understand. The issue is bring them up to speed with what is happening. And they are able to comprehend and even support. I must emphasize also the global and the national, WASH days. They are important days for just, again, enhancing messaging, modeling, demonstrating, cleanups, for example, in markets, in your school, in your home. So you can see there's a very direct correlation between working with children at the school platform and what they go and do at the household level and what they go and do in their community. So children are very powerful agents of change. I think we just need to make sure that we structure our interventions, our messages, our skills development in ways that really empower them to go and speak and spread good habits and practices in homes and in the communities that they come from. Yeah.
Wow. I think we have, I think all the preconditions are there. We have gathered them, we have them in a field somewhere. All we need to do is just to now come and arrange them in proper sequence, and we take off.
And in fact, I forgot something, which I think is important. I hope it will wow you, Daktari, in the way that it wowed, Chris wowed you. One of the things that we have been pushing in Kisumu, and it has really worked well, is how the health and the education teams and platforms can leverage on each other. And we modeled using the community health strategy, the CHPs, treating schools as a household, So the CHPs will go in and do the growth monitoring progress, look at immunization card, mother-to-child booklet, etc. But then in turn, we are encouraging the health sector also to leverage on this whole population which if supported in the right way, will completely be agents of change in this kind of initiative. So how can the different systems at county level, even at national level, leverage on each other to really bring out positive outcomes? And I think this is one area. I think we can harness the potential of children as change agents, especially in this campaign. Thank you.
Yeah, thank you. I agree with you totally about being able to just reorient our thinking around the community health strategy. Dr. Ikau will tell you that when we started the UHC program, Chris was there as well. And I was trying to also push for the same thing. In Afia House, we have 6 floors. So I was offering to be the CHP for the 7th floor, so that I can be going maybe to the cabinet secretary's office and then I take blood pressure and things like that. But that idea never really worked. So maybe if it starts from schools, a classroom becomes like a household, and we can be able to showcase that it doesn't have to be the actual households. We can do it in any other place. I think that would really be. So I want to open it up to the audience. This time, don't wait for the panelists to go and then you now remember you have questions. Yeah, I will only allow, because of time, I'll only allow 3 questions. So maybe if you have any questions, you can field them.
Thanks, colleagues. And having listened to all the panelists, I think this is a very innovative approach, because once we are talking about preventing illnesses, and for us to be able to prevent illnesses, having listened to the panelists, I think one thing is that is more of behavioral interventions and wellness interventions for us to be able to prevent illnesses. And one of the things that is running in my mind is that when you're talking about Epuka Uchafu campaign, are we reaching the right audience, targeting audience? Some of us, we have been brought up with the littering everywhere, including urinating, going somewhere and just urinate. Now, I want to think Wangoi has brought up in a very good idea, or a good intervention. The school-going children. If we could be able to say, and just to add from the first speaker here, is that how this should not just be a Ministry of Health intervention, but at the school, that is where the young age at ECD we start the behavior change at early childhood development. And the way they are learning A, B, C, D, they are also learning about hygiene, they are also learning about sanitation. And it becomes part of their system. Right now here is that for us, probably this age, the way we were used to littering and doing everything, it will be very little to change. So for me, the thing here is that at what point do we curriculum? We look at the teachers training colleges and we start revising their curriculum just to add an element of Epuka Uchafu or whichever way we'll want. And then it becomes part of early childhood development curriculum for us to be able to ensure that we bring up a generation for long-term impact for us to be able to create. Thank you.
Thank you for that. Although you're trying to become a panelist, yeah, but a very good contribution. So we can listen to you and then we go back to the panelists.
Thank you. My name is Oguda. I come from Migori County, and all along I've been listening the Puka Uchafu concept and trying to merge it with the advert that Tomo used to carry out, saying that is good. So that is good, and we are pukering it. I don't know, but that is just a curtain raiser for me. I saw last year, December, when my first lady did a campaign called Kambila Vijana. And so many youths, school-going youths were there, and the whole concept was about behavior change. Like those youths were being taught to be ambassadors of behavior change. I'm wondering how or why such foundations can't be maybe merged and used, maybe to be used nationwide, be given capacity to run this behavior change. For them, it was about reproductive health. It was about things to do with morals that keep our societies right. And if we can merge this epuka uchafu thing so that children are taught sanity while they are young, so that it's one thing. My whole concept is we can take kids in December, teach them how to epuka uchafu, add maybe other behavior change practices or needfuls in it, but using the already existing foundations that do it, that drive it, maybe now to do them nationally. Thank you.
Mine is just to appreciate all that is being done in WASH from different stakeholders. And I just want to appreciate now that we've gotten Epuka Uchafu Afya Nyumbani. We really need to come together as stakeholders so that we do one thing. This is Epuka Uchafu Afya Nyumbani. We do it together so that we can achieve quite a lot of achievements. Because if you go singly, you may not achieve what you want to achieve. But if we do it collectively, I think we shall achieve this. I'm saying this because I've been in the WASH area for quite some time. We've done a lot in Kenya. The CLTS that has been talked about, we've done it. School health programs, we've done them. And but if we can merge them, now that we are here as stakeholders, we do them together, collectively under one umbrella that is called Epuka Uchafu Afya Nyumbani, we are going to achieve quite a lot of milestones. Thank you.
So even as you consider making some comments on what has come out of the floor, I also want you to think about the following question. In your own individual capacity and in your capacity as a member of your organization, so on behalf of your organization, what would be your commitment towards scaling up the Epuka Uchafu campaign? Just think about it, even as you make some comments on what has come from the floor. I'll give you just a very short 30 seconds so that we can at least also wrap up and allow people to go back home. So we start with you, Waziri.
First of all, I think there's a difference in British English and American English. So I'm persuaded that the Omo advert, that is good, was American, because that in America is soil. But then the uchafu we are talking about is uchafu. Na lazima tuepuke uchafu. So uchafu is not good. So I support the PS on that one. Also, in terms of my commitment as a CC member for health, one is to lead by example. If we say we are doing this, we are rolling out this initiative, I must lead by example. One of the things that I'm persuaded that we are not doing well as a government, I mean across the counties, is leveraging on existing mechanisms such as the WASCOs. You know, in Nakuru we have Narwasco, Nawasco. I'm sure you all have those. But then how is it that they provide water, but they don't provide it for free in the schools? And so we have to struggle to figure out how the schools are going to get access to water. So it is one thing to say to Nawa Mikono, it's another thing to say is the water available. We have a lot of our public facilities, schools, health facilities that rely on rainwater. It is not enough. Even when we talk about, and Wangoi has talked about menstrual hygiene and the availability of all these packages, some of the schools are so, basic in terms of facilities. Even in the class, we cannot talk about the menstrual hygiene bin. We cannot talk about sanitary pads. So what what is it that we're going to do as a county, as a government, to figure out how to support our girls, to restore dignity. That is my commitment. The other thing is to really take seriously the campaign messages around the international days, and I think, Wango, you've talked about that, the menstrual hygiene day, the World Toilet Day, the hand wash, there are so many. But we cannot leave the actions on that day. We must run with the idea. We have all this movement from Bora Cho to Cho Bora. It has to go to the very basic units of our community. Thank you.
Once again, I would want to say there is hope. Remember, London at one point, those developed nations were at where we are today. But they transformed themselves. A country like Rwanda, which is just miles away from Kenya, was where we are today. But Rwanda doesn't look like Kenya. So there is hope. But for us to get to that vision, we have to stop complaining, we have to start acting, and it begins with an individual. Don't wait for the government to come and tell you what you are supposed to do. It is a message which needs to reach each and everyone, and the actions need to begin all the way from ourselves to our household and in our societies. Then you asked us to talk about our commitments. Of course, I'm very committed to begin with. As a champion, I'll use my voice to continue spreading this gospel, which is real and true. But at the same time, as an organization where I work from, AMREF, I have many bosses here, including yourself, Sultani and Gilbert over there. It is a commitment for us to spur primary health care. And we can't achieve primary health care without epukaling uchafu. So it's a commitment that we would want to take as an institution, and I personally, I would be very happy to see that we are forming a cooperative. Make sure that Grace, nobody from this panel escapes from following through the ones which they put here. Yeah, so thank you.
I'm a gynecologist. Huh? So whenever I go to a hospital that has delivery services, I usually go to maternity. And if you want to measure the level of hygiene of any hospital, if the maternity is dirty, then there's a big problem in that facility. So one of the commitments, Dr. and the rest that we have, is that CHAC has a platform at different levels that you can actually use to do what I usually call controlled programming. Controlled programming because we have specific ways in which we do things, this other side of the divide. And we have a platform that we can be able to use to pilot some of the interventions that we have. At the community level, of course, I've talked about the pulpit and the interventions, you can do that. The facility level, we have a number of church-sponsored schools. If I asked all of you here in this room whether you went to a church-sponsored school, maybe all of you went to a church-sponsored school. So it's a platform, an easy platform that you can actually get into in terms of school health clubs, for that matter. We have a number of universities and colleges that we actually are under the CHAC membership. And lastly, the bishops and ourselves, we can knock to any door in terms of advocacy, and it will be opened. So we can provide that platform that can be able to actually enhance the support that can be able to be engaged. I want to finish by saying that please engage us at the design level. Don't involve us at the implementation level. We are available to come in at the design level so that we can walk the journey together towards this. Thank you.
Thank you very much, Daktari. For me as an individual, it's one thing that I want to commit to continue championing Epuka Uchafu Afya Nyumbani, because this is one thing that I desire as a person, and I will continue doing it within the environments that we are in as an organization. And of course, as Kenya Red Cross, I want to say that we want to commit that strengthened coordination at the grassroots level is key and very important. And leveraging on the resources, the personnel that we have, whatever we want to do, let us also embrace the messaging of Epuka Uchafu, and of course, bringing this into those that are still coming up. And of course, the other panelists have clearly stated that through the children remember, and of course, play a vital role in even sensitizing the community. And now that we have Red Cross clubs within the 47 counties in Kenya, this is one thing that we want to commit, that under the Red Cross clubs, under the health programming, this is one of the key messaging and education that we want to put forward to be able to these kids, so that they can be able to be the change makers in the society. Lastly, I want to say that we really need to look at it, and of course, this has happened in many, many other countries. And of course, even in some of our towns in this country, you'll walk in some of these towns and you'll be embarrassed if you want to litter that town. And I will tell you, you'll keep that litter in your pocket because of the behavior and what people else is doing around you. So what I want to say in that this starts with me to be able to achieve this initiative. And of course, this is a collective responsibility, and remind each other in terms of ensuring that we have a clean and healthy environment to live in, so that we can also reduce the upsurge of the diseases, and of course reduce the burden of treatment at the end of the day. Thank you very much.
Thank you. I'll attempt to answer the question from the floor about when, how do you train the next generation so that there is that behavior change. And I think it starts at your house. You start in your house, work with the people in your house, including children, and then when they get to institutions like schools, it's not even a new thing. It's something that they just carry forward. So I don't think our generation is far gone. I think we just need to take responsibility and also say that as for me and my household, I will ensure that I'm upholding sanitation and hygiene standards right from where I live and with the people in my household. So I think that is where it really starts. It really is a personal responsibility. And then what do I commit to do? When at UNICEF, when we are, crunching numbers, looking at data across counties, one of the things that keeps on coming up is that sanitation or poor sanitation is one of the key drivers of childhood poverty. One of the top three. I think, in fact, probably all of our 47 counties. Of course, some are doing better than others, but it is one of the drivers of childhood poverty. And everything else flows from there in terms of disease, in terms of death, and so on and so forth. And so my commitment is that during the development of the annual development plans, in the review of CIDPs, to really advocate for increased allocation for sanitation activities. Because even in the health docket, when you look at how much goes to sanitation, it's a drop in the ocean in most county budgets. And then now, not to look at sanitation only from the perspective of health, but it's, again, multi-sectoral. And to push that when we're having conversations with counties about how they are planning and how they are budgeting. Because that concerted effort is what will push all the allocations for sanitation across the board. And hopefully, we can stop having sanitation or poor sanitation as one of the top three drivers of childhood poverty in our country. Thank you.
Thank you very much. Now I want you to join me in giving our panelists a big round of applause as we thank them for the good work that they have done. And I will invite them to take their seats so that we can now move towards closure. Your Excellency, First Lady of Migori County, I want to tell you a secret that I have been keeping. You know, I was just monitoring you as we were waiting for the session to start. And you came in, you left, you came back. And you have been very patient, listening and following and so on. In my 20 years experience of public health leadership, I keep on telling people that political leadership is extremely important for any public health programs. If you have the best technical strategy and so on, and you don't have a political buy-in, then it is very difficult to succeed. But what I have seen today is a certain level of commitment. And given that very high level of political leadership that we are looking at, then I would like to really confess that I am very impressed. And I believe that in you, probably this initiative has a hero. And moving forward, probably we have a very good starting point because with the kind of commitment I've seen, it is very genuine that we have that level of ownership. And, you know, I'm just looking at the program, and initially we had expected to have quite a number of high-level political leaders. Unfortunately, some of them could not make it. And I know probably even you, your schedule is very full, and you would have been unable to make it. But what you have shown us is prioritization. So I am very proud, I'm very encouraged. I believe that we are off on the right footing. Because at least even at that level, there are those who believe in what we are doing. So I would just like to invite you to make some remarks so that we can be able to listen to your wisdom before we have the final closure. Please join me in welcoming our First Lady, Dr. Agnes Ochilo, so that she can be able to make some remarks to us. Karibu sana, Madam First Lady, Your Excellency.
Distinguished guests, partners, I can see a lot of Migori County here. Good evening. I think we would have been more of us. When we came, we were 3 First Ladies. So receive greetings from the First Lady of Siaya, Her Excellency Betty Orengo. She also came here, looked, waited, and went. And also the First Lady of Nyamira, Emily Nyaribo. She also came here, waited a little bit, and had to go. But because of the statistics we have in Migori, I had to stay and ensure that something is done about what has been proposed. Also receive greetings from Migori. Migori is not far from here, for those of you who don't know. It's just about 15 minutes, and you're in Migori. And Migori borders 3 counties. This one where we are, which is Homa Bay. Then we also border Kisii and Narok. What you have enjoyed here in Homa Bay, you can also enjoy in Migori. And in addition to that, Migori is 40 minutes from the Masai Mara. So you can go have fun, look at our beaches, eat some fish, and it's culturally rich. It's one of the counties that people believe is a Luo-dominated county, but we have various cultures. As a matter of fact, 1/3 of our population is the Korean community. So it is quite diverse. If you came, you'd be able to enjoy quite a bit. And by coincidence, we also border 2 countries. So we border Tanzania along Hispania, Sirare. By the way, Hispania and Sirare is the same place. It's only that on the other side, Tanzania side, it's called Sirare. Kenyan side, it's called Hispania. And of course, at Migingo, we also border Uganda. So if you're in Migori, you are just a few minutes away from the 2 counties, from the 2 countries and the 3 counties. I don't know why I think I should have been put as one of the panelists, because what I'm discussing actually has already been discussed, but I will just summarize and read what is written out so that I don't take a lot of time. The problem with the politicians' wife, we tend to imitate them, and we end up speaking so much. So I'll stick myself to what is written so that we finish very fast. Yeah, it is with humility and immense gratitude that I stand before you today. I feel honored to have been named the county champion for the Epuka Uchafu Afya Nyumbani initiative. This recognition is not mine alone. It reflects the collective spirit and commitment of the Migori people to build a healthier, cleaner, and more dignified future for every household. Epuka uchafu afya nyumbani is a Kiswahili sentence. I'm not so good in Kiswahili, but I tried to translate it. I thought it was, you eliminate that in exchange of improved health at home. It is a public health initiative campaign launched by Kenya's Ministry of Health to promote clean and healthy households. The campaign encourages communities to maintain clean, healthy environments through proper sanitation, waste management, and hygiene. It is anchored on the belief that public health begins at the doorstep, and that sustained community-led action is key to preventing disease and improving quality of life. Ladies and gentlemen, by empowering residents to take responsibility of their surroundings, Epuka Uchafu reduces environmental health risks, fosters behavior change, and strengthens collaboration between citizens, local leaders, and public health officers. Epuka Uchafu Afya Nyumbani journey was marked by a significant milestone when the multi-sectoral steering committee for the initiative was launched by the Principal Secretary for Health and Professional Standards, Madam Mary Mudhoni, under the auspices of our Governor, Dr. Honorable Ochilo Ayako. This was followed by a cleanup exercise in Apida slums. In fact, some of the pictures you are seeing there, for me, they are home. It is an area I know very well. And we were glad that the exercise managed to reach over 3,500 residents with life-saving sanitation and hygiene messages. Thank you very much. Migori County, I saw as one of the, we are talking about the ports of entry. Migori, as one of the Kenya's major ports of entry, carries a heightened public risk for disease transmission. Recently, the county reported 53 cases of cholera and 1 case of mpox. These realities reinforce the urgent need to strengthen public health and surveillance and resilience. A clean environment is one of the most effective shields against disease, a truth we must embrace, not as a one-off activity, but a culture and a way of life. I think the ministry will have to look at the days, because these areas we have a very high population of SDAs. So putting it on Saturday may not work, and Sunday may also not work. So we have to go back to the drawing board and or allow counties to choose days that work for them. Ladies and gentlemen, as already been mentioned, there are very many benefits that accrue to Epuka Uchafu initiative, which is basically a communal environmental cleanup exercise and a campaign. Of course, I'll not go through them again because they've been mentioned here: disease prevention, enhanced public health surveillance, community empowerment, improved waste management, economic benefits, the youth and the women engagement, strengthened community cohesion, environmental protection, and support for the UHC agenda that was mentioned. Ladies and gentlemen, my appointment as the champion for the Epuka Uchafu Afya Nyumbani initiative reflects a strategic and symbolic choice rooted in community engagement, advocacy, and inclusive leadership. While the governors hold executive authority and leads county-wide policy implementation, the role of the county First Lady offers a unique platform. First Lady or First Gentleman, the spouse to the governors, one that is deeply connected to the household, the community, and the everyday realities of family life. This initiative that targets the grassroots level aligns naturally with my influence and outreach, which resonates well with my presence in community spaces, schools, market, health centers, and thus makes me an effective messenger for behavior change and local mobilization. In my role, I can be anybody and anything. You'll find me under the trees with the women. You'll find me in the fields jumping with the children. So it is a role that can be very critical for this initiative. As leaders, partners, and citizens, our task is to sustain this momentum. I've had the medical professionals talking about initiatives that were initiated and they've more or less died along the way. I want to encourage us that this one, we should ensure that we sustain this momentum to make an environmental cleanliness a daily habit, not a ceremonial occasion. Let us invest in preventive health, protect our people, and build a healthier, wealthier Kenya. Recently, Migori County was honored to host the first NutriWash conference, and the resolutions from this conference complement the Epuka Nyumbani initiative, Epuka Uchafu initiative. Some of the resolutions that were reached were to have stronger partnerships, which we are still talking about here. We have stronger partnerships with governments, NGOs, academia, and the private sector. We integrate WASH into all nutrition programs and policies, promotion of behavior change through cultural sensitive messaging, nutrition and hygiene education in schools. A lot has been mentioned about school. Prioritization of WASH in flood-prone and drought-affected areas. As a matter of fact, those are issues that affect Migori County. We have floods and we also have very dry areas. And then we need advocacy for increased budget allocations for WASH and nutrition, and then establishment of joint WASH nutrition coordination platforms. Ladies and gentlemen, I pledge to use this role not for ceremony, but for service, to advocate for clean homes, nourished children, and empowered communities. Secondly, I pledge to work alongside our health workers, our mothers, our youth, and our leaders in building Migori and Kenya that is healthier, stronger, and united. And even as I'm saying this, I think that's why I was not put in the other group. My office is not constitutional in the first place. My office is not funded in any way. That's why I think you excluded me, because those ones are constitutional offices, and those are people who already have their own money. First spouses may not have allocations to support any program. We use our voices because our voices carry a lot of weight. Our platforms can inspire change, and our commitment can mobilize action. My commitment has just mobilized action, you saw that. The governor's spouses have been initiating and spearheading a number of programs within their counties. We have different levels of engagement. Number one, we have our County First Ladies Association that covers all the 47 counties, and I'm privileged to be the deputy chair of that group. Secondly, we have the regional groups, like we have the LREB block. We also have a grouping, we have our own association. And then also we have individual county first ladies initiating their own programs through maybe institutions like that they have set up. Like myself, I have set up Mama Agnes Ochilo Foundation. It happened that there are certain partners who maybe would prefer to have their activities move faster, or they are scared of engaging the county. So for that, because our work is actually to complement what the governors are doing and the counties are doing, some of them even opt to work with us. And I'm proud to say that through those collaborations with various partners, my foundation has been able to set up a sickle cell clinic in Rongo sub-county. I think for those of you who have visited the Migori booth, you'll see, you've seen the presentations they have there. This is a clinic that before I set it up specifically to serve sickle cell, they only had 30 patients. But after I introduced the clinic, now it serves about 320 patients, and most of them are children. And we have been able even to find a way of giving them cheaper medicine through revolving funds, where we are able to get the medications and then we dispense to them at cost. And then we have also been doing a lot of fistula corrective surgeries. For the two sessions I've had, we have been able to restore dignity for over 300 women. And those are the things that give me the passion to find ways of helping our people. I've also managed to empower about 16 widow groups through support from the groups. What I'm mentioning have nothing to do with the county funding. They are funding that I get through the various partners. And also we have put together women who are successful and come from Migori County, and we've been going around schools mentoring girl children, and I've been reminded that now from next year we must also include the boy child. So we are looking for men who can join our group so that we can visit schools and speak to the girls about their menstrual hygiene, about their mental health, about their the changes in their life, and most critical academics. And so far we have managed to visit over 25 girls' schools. And through partners, I've had partners who have been able to give me funds, and we've been able to buy 3,250 ECD chairs, which have distributed to various schools. Our county still has a challenge in initiating the school feeding program, but I have one partner who has assisted me to initiate school feeding program in one school. I think they're still working on ways to be able to have the feeding program. And also I've been able to have accelerated advocacy and awareness in cervical cancer prevention and management, and more specifically the HPV vaccinations for the young girls. In conclusion, I would say that together, let us say no to filth, yes to health. Let us nourish our families, protect our environment, and uplift our county and country. Let us make Epuka Uchafu Afya Nyumbani not just a campaign, but a way of life. Let us work together for a cleaner, healthier Kenya. Thank you all, and may God bless you, and may God bless our country, Kenya. For the partners who are here, there are many of us, like myself, who are willing to work with you. The only challenge we have is that we don't have any allocation, because even if the county wanted to give me money, there's nowhere they'll be able to sign that money is given to the First Lady. But we've had partners who've worked with us. So if you need to work with us, we are willing and ready to work, because our priority is to improve the health of our communities, whom we see on a daily basis. When our husbands are campaigning, we normally walk around with them, and while they're looking at the issues of the roads, we are looking at the softer issues, and we realize you'll build roads all right for these people, but the sanitation, the hygiene, the sicknesses that they still experience cannot be solved by the infrastructure. Thank you.
Yeah, thank you very much. Let's give a befitting round of applause to our Epuka Uchafu Afya Nyumbani champion. And I must say that we have a big catch. Yeah, the vice chair of the First Ladies Association is not Mutu hivi hivi, sindio? Sasa at least tumeshika a big catch. And Your Excellency, don't worry. Wewe tutakaa tu kando, hao mapartners tutaongea nao, alafu hiyo maneno yenye unasema. Hawa ni marafiki zetu, hawa kina Mushangi, hawa kina Wangalwa, kina Wangoi hawa. Na hiyo budget haiwezi kosekana ya mambo vile tutatembea. So hiyo tutapanga kando. Sawa. And I think we are off to a very good start. We are really encouraged. Now, when we started, I had indicated that our principal secretary, this is something that is very, very dear to her. And she had a few sentiments that she wanted us to share, and especially just around her gratitude towards being able to mainstream into this vision. But at the same time, I want to take this opportunity maybe to also just combine this with a few takeaways that I've been able to note down. And first of all, it's just to acknowledge all of you for finding time to come and attend this very important discussion. And specifically to our speakers, our organizers and partners from different organizations. We have had the involvement of AMREF, UNICEF, Kenya Red Cross, CHAC, the county government executives, from Nakuru and other counties, from Migori and other counties. Thank you for your perspectives and on how to advance the momentum of this great initiative. A big thank you also to the leadership from the counties, from the First Lady, and also, of course, by extension, from the leadership of the counties as well. And specifically to our First Lady for delivering a very powerful address that provides policy direction on what we need to do to move forward. Asante, asante sana, Your Excellency. Now, the key takeaways that I just want to share, maybe as an immediate reflection, we have gone through the 4 pillars of this transformative nationwide campaign. That is personal hygiene, environmental hygiene, health promotion at the ports of entry, and access to safe water and proper sanitation. Various speakers have taken us through various strategies to realize cleaner households, healthier communities, and a safer environment through this campaign. That the campaign has started already with 7 counties so far, because we have been to West Pokot, Machakos, Kisii, Narok, Kisumu, Migori, and Tharaka Nithi, and that the momentum is growing steadily to reach every community in every corner of this country. That Kenyans will be coming out every 3rd Saturday, although Your Excellency, we have taken note of your contribution from the partners present on potential areas of collaboration. Kenyans will be coming out every 3rd Saturday with the modification of the month for public health action days to clean up our towns and villages for disease prevention and healthier communities. And finally, the power of partnerships. We have had commitments from the partners present on potential areas of collaboration between the national government, counties, partners, and communities in order to push this momentum to the next level. And so, we want to propose this call of action, this call to action, where we are saying that what is needed is a united and sustained effort from all stakeholders. We are therefore being called upon to join this movement wherever you are and within our various capacities, all of us present in this forum and event, those who didn't make it here today. We can do this through the following ways. Collaboration between the national government, council of governors, county governments, and partners in making this initiative a success. Number 2, empower communities, that is to take ownership of the cleanliness of their households and the environment and sanitary conditions, fostering locally driven solutions that are both sustainable and effective, even in the resource-limited settings. Social mobilization for public health action days. Let's all come out every 3rd Saturday with modification of the month for nationwide cleanups in order to reduce the prevalence of disease associated with poor hygiene and sanitation among our communities. Leave no one behind. Let us ensure that we address inequalities and promote inclusivity and equitability in the campaign activities regardless of social, economic status, gender, disability, geographical location, or any other factors. The target is to reach every community in every corner of this country, both in towns, urban areas, and in villages, that is the rural areas. And then finally, alignment with local plan. Different counties have different priorities and challenges. One size does not always fit all. Interventions in different communities must therefore address the local needs and priorities to maximize outcomes for a cleaner, healthier, and wealthier Kenya. And on my part, I want to say that now that we have our champions ahead, our PS and our First Lady, hata mimi hapa nyuma nataka pia nikuwe ka champion kadogo. Kwa sababu sasa machampion wakubwa wako hapo mbele, so now as we have a space and a shield, we can follow through. So I am completely sold out. So the way forward, in pursuit of the goal to engage every village, every community, and every home, we will activate more counties in the coming months, including Murang'a, Nakuru, Mombasa, Nairobi, Kwale, Turkana, Samburu, Laikipia, and Embu, among others. At the Ministry of Health, we commit to execute our constitutional mandate at the national level by providing the policy framework as well as technical support and the capacity building to counties to contribute to the successful rollout of the initiative. Let's work together to build cleaner households, healthier communities, and safer environments for preventive health, improved livelihoods, and national prosperity. We can clean up Kenya, one household at a time. Thank you very much. May God bless you. And thank you very much. Have a safe journey back home. Asanteni sana.